Vi. A known history or present condition of allergic response, hypersensitivity to any cosmetic ingredients and pharmaceutical products. 7. Subjects on oral medications which will compromise the study. 8 subjects who are pregnant or lactating or nursing as established by medical history. 9. Under medical treatment for hair problems. X. Undergoing any chemical hair salon treatment. 11. Straightening, perming, color. 12. Pregnant female subjects as determined by UPT test. 13. Chronic illness which may influence the cutaneous state. Subjects participating in other similar cosmetic or therapeutic trial within last 3 months. 14. Any history of underlying uncontrolled medical illness including diabetes mellitus, hypertension, HIV, hepatitis, severe anemia, serious disorder of heart and respiratory apparatus or any other serious medical illness. The main objective of the study was to evaluate the efficacy of the test product after its application process over 3 months to treat anti-HF, and the subjects were tested for dermatological assessment, corneometer assessment of scalp, comb test and pull test, subjects self-assessment, hair tensile test. The secondary objective is used for the assessment for application site reaction, activity, tolerance of the test product. Subject assessment and visits. The study was conducted for a period of approximately 90 days for each subject. It included a total of 3 visits, that is, Day 0, screening, Day 1, baseline, Day 30, Day 60 and Day 90, follow-up visits. Dermatologist's assessment of efficacy was done using a dermatological assessment questionnaire. This study was approved by the IEC Clinicom Ethics Committee. The study was conducted at MS Clinical Research Private Limited, Bangalore. The subjects who satisfied the study inclusion-exclusion criteria were enrolled after obtaining informed consent. A total of 35 adult female subjects aged between 25-55 years were enrolled in the study. The studied hair oil was the test product used in this study, where the subjects were informed to apply the product thrice in a week. Test product, studies hair oil. Dermatological assessment. A hair fall evaluation by comb test. Comb test was done on visit 1, DB, Day 0, visit 2, Day 30, and visit 3, Day 90. B. Hair fall evaluation by hair pull test. Hair pull test was done on visit 1, DB, Day 0, visit 2, Day 30, and visit 3, Day 90. C. Hair texture, assessment for hair texture, roughness/smoothness, fragility by hair thickness evaluation. Comparative scales had been prepared by MSCR using hair swatches to aid in subjective assessment and improvement of scalp condition, which was performed on visit 1, DB, Day 0, visit 2, Day 30, and visit 3, Day 90. Assessment for safety. 11.2.1 Assessment for site application reaction by dermatologist. Dermatological assessment for local scalp irritation was performed on the following parameters on visit 1, 2 and 3. 1 equals dryness. 2 equals erythema. 3 equals scaling. 3 equals allergic reactions. 4 equals folliculitis. 6 equals any others. Assessment for site application reaction by subject. The subjects were asked to observe the changes in their scalp conditions of the application site throughout the study term and inform the same to the investigator on their site visits. The subjects were also advised to make a note of any kind of scalp irritation during product usage in the subject diary provided. This was recorded under subjective assessment for application site reaction in all visits. 1 equals burning sensation. 2 equals boils on scalp. 3 equals itching. 4 equals oiliness. 5 equals any others, specify. 11.3 Subject self-assessment. Subjects were asked to observe their hair fall rate, hair texture and hair volume, They were informed to score the skin attributes as per the scale provided to each attribute in subject self-assessment questionnaire on Visit 1, Visit 2 and Visit 3. The score was recorded in subject self-assessment form. At the end of study Visit 3, Day 90, subjects were asked to provide their opinion about test product. Instrumental measurements. Corneometer. Corneometer was used to determine the hydration of the scalp. It was used on all visits of the study. The probe of corneometer was placed on the intersection of horizontal and vertical section of the scalp. An average of 3 measurements was considered for the analysis at each point of the study. 15. Table 1. Table 1, Initial determination of the hydration of the scalp using corneometer. Hair tensile test. Total of 15 hair strands were collected from the root where 5 hair strands were used for hair strengthening analysis using hair tensile tester and remaining 10 hair strands were sent to sponsor on first and last visit. Table 2. Table 2: hair strengthening analysis using hair tensile tester. Hair fall by comb test. The test was done by observing the amount of hair loss happened after the usual combing process. Evaluation of hair fall by hair pull test. A bundle of about 50-60 hair was grasped between 2 fingers. A constant traction force in the direction of hair growth was applied to pull out the hair. Pulled hair was counted and documented. A reduction in hair fall is a sign of hair strengthening from the root as it resists falling due to pull force. Hair texture. Hair texture assessments included 2 different, that is, hair softness and hair thickness. Each parameter was provided with different separate scales which were used for assessments. Scalp condition. Visual assessment was performed using a microscopic camera on the following parameters, that is, dry, oily and normal. Image analysis. Image analysis was performed visually by dermatologists, where the images were captured at each visit and these images were compared to baseline images to determine the overall improvement in hair thinning. Results and discussions. Efficacy assessments. Dermatological assessment. Dermatological assessment was performed on all visits, that is, baseline, Visit 2, Day 30, and Visit 3, Day 90. The hair fall evaluation was done by comb test and hair pull test. Hair texture assessments included 2 different parameters, that is, hair softness and hair thickness. Each parameter was provided with different separate scale which was used for assessments. Evaluation of hair fall by comb test. Comb test was performed to evaluate the efficacy of test product post-application in reducing the hair fall due to combing force. The count of fallen hair with a bulb and without bulb was then recorded separately. Hair fiber with bulb represents hair fall from root and hair fiber without bulb represents hair fall due to breakage from the shaft. Subjects were asked to partition their hair into 2 equal halves. Subjects were provided with a standard tooth comb, to comb each half of the hair in continuous stroking. The fallen hair was collected on a white sheet and was recorded. Hair fall with bulb, Table 3 Figure 1. Table 3, Determination of hair count with bulb. Figure 1, Hair count with bulb. After 30 days of test product application, there was a slight decrease in hair fall rate but it was not found to be significant. The hair fall reduced by 15.71%. After 90 days of test product application, significant reduction in the hair fall was observed in comparison to baseline. The hair fall reduced by 49.26% at last visit in comparison to baseline. This infers that the test product was efficacious in reducing the hair fall. The hair fall with bulb was approximately 1.97 times lesser at the end of study over baseline. Hair fall without bulb, Table 4, Figure 2. Table 4, Determination of hair count without bulb. Figure 2, hair count without bulb. After combing the hair, the fallen hair without bulb was counted and documented. After 30 days of test product usage, reduction was noted in hair fall without bulb, but it was not found to be significant. After 90 days of test product application, significant reduction in the hair fall was observed in comparison to baseline. About 40.54% of hair fall reduction was noted at last visit in comparison to baseline. This infers that the test product was efficacious in reducing the hair breakage. The hair fall without bulb was approximately 1.68 times lesser at the end of study over baseline. Result observed. After 90 days of test product usage, significant reduction in the hair fall was observed in comparison to baseline. Hair fall with bulb reduced by 15.71% and 49.26% at day 30 and day 90, respectively, in comparison to baseline. This implies that the test product was efficacious in reducing the hair fall with bulb. After 30 days of test product usage, reduction was noted in hair fall without bulb, but it was not found to be significant. Further, with continuous usage of test product, 90 days, there was significant reduction noted in the hair fall when compared to baseline. About 40.54% of hair fall reduction was noted at last visit in comparison to baseline. This infers that the test product was efficacious in reducing the hair breakage. The test product was efficacious in reducing the hair fall and hair breakage after application of test product when subjected to combing force. Number of hair pulled. Number of hair pulled that was counted and documented. Table 5. Table 5, number of hair pulled count. Sum of all 4 sections was calculated for each visit and then analysis was performed. Significant decrease in the number of hair pulled that was noted at day 30 and day 90 in comparison to baseline. Hair fall reduced by 58.43% at the end of the study when compared to baseline. It was noted that the hair fall was approximately 2.41 times lesser at the end of study over baseline. Hair pull test score. Number of hairs pulled that was counted and a score was allotted based on the scale given below. Scale: 1 equals none, 0 hair strands, 2 equals negligible, 1 2 hair strands, 3 equals mild, 3 4 hair strands, 4 equals moderate, 5 6 hair strands, 5 equals severe, more than 6 hair strands. An average of 4 sections at each visit was calculated and analysis was performed on the average value. Table 6, Figure 3. Table 6, hair pull test score. Figure 3, hair pull test score. Reduction in the score is a sign of improvement. Significant reduction in the score was observed at day 30 and it continued till day 90 in comparison to baseline. Hair fall reduced by 22.09% at the end of the study when compared to baseline. It was noted that the hair fall was approximately 1.28 times lesser at the end of study over baseline. Result observed. In hair pull test where a force was applied to pull the hair out, significant reduction in the hair fall was noted at day 30 and day 90 in comparison to baseline. Hair texture. Hair thickness. Hair thickness was performed to determine the fragility of hair. The scale mentioned below was used by dermatologists. Scale: 1 equals very fine hair, 2 equals fine hair, 3 equals medium thick hair, 4 equals thick hair, 5 equals very thick hair. Table 7, Figure 4. Table 7, hair thickness test to determine the fragility of hair. Figure 4, hair thickness.